Welcome everyone to the 25th edition of the Genesis Pitch and Pick. My name is Maggie Korish and I'm the Startup Development Coordinator for Pre-Incubation at Genesis. And I am thrilled to be here today to introduce some of the graduates of our Evolution Winter 22 cohort. Genesis is excited to host this event both in person and virtually today. I would like to give a special welcome to Honorable Andrew Parsons, Minister of Industry, Energy, and Technology. And we want to thank Verafin for providing us the space to host the 25th Evolution event today. Some housekeeping items. So we are recommending that everybody keep your mask on while in our event. You can take it off for eating and drinking. Please help yourself during our break to our amazing spread of food from the Hungry Hearth Cafe and the drinks from Toslo. The washrooms are right at the very entrance when you first came in. There's on the left and the right-hand side of the entrance. And the fire exit, God forbid anything happened, is just right there at the back of the room, and that would be the exit. Photography is only allowed from the red pillars back to the stage here, or to the podium. So the red pillar is just the very midsection of this room and back here. And if anybody didn't register when they came in, I know there was some different doors used. So if anybody didn't register and you didn't get your drink tickets, please check with one of the Genesis staff members and we'll make sure that you get your drink tickets and are all sorted out when we have a break. So now I would like to invite Lara to the podium to do our, yes.
Welcome everyone. Well, before we start, we would like to acknowledge that the land where Memorial University's campuses are situated are on the traditional territories of diverse Indigenous people. And we acknowledge with respect the diverse history and culture of the Beothuk, Mi'kmaq, Innu, and Inuit of this province. Thank you, everyone.
So I would like to tell you a little bit about Genesis. Genesis helps build amazing companies. As Newfoundland and Labrador's preeminent innovation hub, Genesis is known for its flagship incubator program, Enterprise, which began 25 years ago. Since its inception, Genesis has expanded its programming to support startups from the ideation stage all the way to scaling their business. Genesis's mission is to create economic wealth for the province by developing and supporting technology entrepreneurs. Now, in the 25th year, Genesis companies have created 2,500 plus jobs, attracted 624 million in private capital, and 220 million in annual revenue. Evolution is also celebrating its milestone of 25 cohorts and has worked with 375 ventures since the program has begun in 2014, including Seafomatics, Metrics Flow, Nucleek, MechMonkey, and Milksta. I would now like to invite Honorable Andrew Parsons, Minister of Industry, Energy, and Technology, to the podium.
Good afternoon, everybody. It's great to be here, and don't mind me if I look a little stunned here. It's just been a bit of a crazy afternoon, and I ran out of the House of Assembly to get here. And believe me, you've never seen anybody so excited to get out of the House of Assembly to actually come up here and be in this room. I've got to tell you, I'm only going to take a couple minutes, but I just want to say it's literally an inspiration just to walk into this room, just to look at this crowd and to see. When I look at it, I just look at opportunity. I think about what can happen in this province. And it's really exciting. And, we're a province that's always, dealt with challenges and always had to, come up with extra effort to get through those. But when I look at Genesis, when I look at Verafin, when I look at the startup community, I see perhaps the greatest opportunity we have in future of this province to get somewhere. And it's pretty exciting to be in a room with this talent. I want to say a big shout out to Michelle and all the team of Genesis. Since my first day on this job, they have been so helpful to someone like me who doesn't come from this background, but welcoming me and educating me and helping us to make, I think, some of the decisions that we're trying to give back and then be as productive and helpful as we can as a department and as a government to the startup community, to the tech community. And so thank you, Michelle and team, for everything you've done. I just look at this building in Verafin, this little tiny startup that you have here. Again, as often they say, you don't need to reinvent the wheel. Well, this is a case of when we look at Verafin, we don't need to reinvent the wheel. We need to repeat this success because when you see that, we just had to jump on board. But you know what? I can say that when you look at this place, you're really like the OGs of the tech community here, and people are going to learn from you. And if anything, it's creating, whether it's in St. John's or up in Port aux Basques or up in Labrador, the reality is that it can happen to anybody here. It doesn't matter who you are and where you're from. The opportunities here, partnerships here, the teamwork is here, and the desire for all of us. Because we all have that desire to see good things for Newfoundland and Labrador. So on that note, thank you for being here. I'm really excited for the teams that are participating. Thank you to the judges and everybody that's making this real. Again, this is my first time here. I am blown away by how cool this is. You got more parking than the hospital down there. So, this is deadly. Like I said, I'm just really excited because that just being here, it really does energize you and make you realize that there's a lot of good in this province going on, and a lot of it's right here now. So on that note, thank you so much for letting me be a part of it. Good luck to everybody, and look forward to seeing you all again soon. Thank you.
Thank you, Minister Parsons. I would now like to introduce Brendan Brothers, co-founder of Verafin.
Good afternoon, everyone. How's everyone? It's nice to see so many people in real life, even though like all these, lights and stuff are set up for all the people at home. So hello, people at home who are watching. Michelle asked me to come up and just say a few words and to welcome you here. Obviously, welcome. As I said, it's nice to see people in real life again. And I know as we're starting to transition back into this world of meeting people and seeing people and flying places and traveling, those are all the kinds of things that get me excited about what I do, right? There's only so much you can look at people in little boxes, and it's nice to be able to see people in real life. I thought what I'd do is, as we talk about, today's event and talk about the idea of, how do you start a business and what are those key things in the beginning? I thought I would tell you a little story. Because, when we think about Verafin and we think about it now, yeah, we've got a super cool building. We've got all these people working on this, really tough problem of money laundering and fraud and things like that. But we came from the exact same place that many of you are coming from here today, right? There's three of us at the Genesis Center starting off trying to figure out how we would solve some of the world's biggest problems, right? And the problem that we were focused on was the problem of fighting crime. We're like, well, how do we fight crime from this little place in Newfoundland? And I remember, one of the very first, most important lessons that we ever learned was getting that first customer and how important that was. And I don't know if we realized that at that point in time, how important getting that first customer was. But when we look back on it and we look at kind of the trajectory that we've had over the last 18 or 19 years, right? Getting that first person, not only to give you money, because money is obviously an important part of it, but probably more important than that, giving you feedback and telling you what you're doing right and what you're doing wrong and where you need to fix things. I don't think you really have a product or a business until you have a customer. And that for us was probably one of our most important lessons. 3 engineers, didn't have a lick of business in us, got a lot of help from the Genesis Center in the beginning, but we made all the mistakes that you could imagine when we started off our business, right? We're like, where are we going to find our first customer? Well, our angel kind of introduced us to some people in New York. So I remember Jamie and I went to New York, and to tell you how long ago this was, we had a demo built in Flash on a CD that we had in our laptop, and we would give out CDs to people at this conference that we went to, and we took meetings with, Bank of America and JP Morgan. Now, 3 yahoos in St. John's trying to figure out how to sell software to Bank of America. I think we were a little bit out of our league. So we said, okay, we'll scratch that. Where are we going to go next? So we met Ron, who's here today, and Ron Taylor from Natty, and he was, talking about international markets and things like that. We're like, okay, well, maybe we can, find a customer international market. So Jamie and I went to Argentina, and I remember we did a demo for a software reseller in Buenos Aires, and they thought what we were doing was really cool. And we had a CD, and I'm pretty sure we had a CD with our source code on it, and we left it there. So there's probably a company in Buenos Aires that's selling anti-money laundering software with, software that was written 18 years ago, but we didn't sign any customers in Argentina either. I think, we went to Australia, we went to the Middle East, we went all over the world trying to find that very first customer. And the greatest story I ever tell about Verifin is getting our first customer, Newfoundland Labrador Credit Union, because we had a board of advisors, and one of our advisors was like, you're going all over the world. Have you ever thought about talking to anybody who's here to see if you can help them solve the problem here? And he was like, I know the people at Newfoundland Labrador Credit Union. I'll introduce you to the people at Newfoundland Labrador Credit Union. And we were at the Genesis Center, and it was this, horrible Newfoundland day, as you can imagine, storming rain and all of that. And if you have to ask the folks at NLCU, they still question why they got aboard their car and drove down to the university to see a pitch from the 3 of us. But we showed them what we were doing. And we talked about the problem of money laundering. We talked about the problem of fraud. And this little credit union, who was just up the parkway from us, had those kinds of problems. And just like that, we were like, okay, these guys have a problem we can solve. We know we pretty much can, start figure out how to solve that problem. And from that point on, we had a partner, we had a customer who we were building product with. And I'm not even joking, we basically threw out everything we had up until that point in time, and we started from scratch, and we built a solution to solve the problems that Newfoundland Labrador Credit Union had. And from there, we got the Atlantic Canadian Credit Unions, the BC Credit Unions, the Ontario Credit Unions, the US Credit Unions, the US community banks, the US mid-sized banks. We're now into the tier ones in the US. We've got international customers, and it all happened because we got one customer and we figured out how to work with that one customer from the very start. So that's I think, the lesson that we generally share when we talk with Genesis companies, and we spend a lot of our team spends a lot of time with companies talking about, entrepreneurship and how to start and how to do things like that. And the key story that I like to tell is that we didn't have to go all around the world to find our very first customer. We just had to drive down the Parkway. And we drove down the Parkway and we found a partner of ours who's been a partner of ours now for 19 years, our very first customer who's still here at NLCU. So that's the starting advice that I would give you today, right? There's all kinds of problems out there in the world to solve. And there's all kinds of really, really hard problems to solve. And figuring out what hard problem you want to solve is the first part, but then finding somebody to help you figure out how to solve that problem is the key. And until you get that first customer who can give you guidance, you're not really solving the problem until you get that first customer. And that's as true for us as it was when we started 19 years ago, as it is today, right? We're in strategy meetings right now, actually upstairs, talking about new markets that we're entering in, and we're trying to figure out how we might solve problems in these different or new adjacent markets to where we are right now. But we know that we really won't be able to solve those kinds of problems until we get a customer to partner with us. So the very same problem that we tried to solve 19 years ago is the same problem we're trying to solve today. We want to build this new cool thing. We've got this really new cool idea to solve this new area in fraud, but everything we're doing is guessing until we get somebody to use it and actually start to give feedback and start that, what we call customer-driven development here at Verifin. So welcome to our home. I sincerely hope you enjoy this afternoon. There's nothing more exciting than hearing ideas and figuring out what kinds of problems we all want to solve. As Andrew said, it can be done anywhere. There's no reason that it can't be done here rather than anywhere else. So good luck this afternoon. I hope it's exciting. I need to go back to figuring out what customer we're going to get for this new thing that we want to solve. But thanks very much for coming, and thanks very much for allowing us to host you here this afternoon.
Thank you very much, Brendan. Now I would like to introduce our judges for today. We have Kevin Peters, Chief Operating Officer of Hickman Operating Group. Neela Kiley, Associate with Cox and Palmer. Sarah Nolan, Account Manager with TD Commercial Banking. Kara Strickland, Intellectual Property Officer with TTCO Memorial University and Springboard. And Jenny Smith, President, Executive Creative Director of Ray Agency. Thank you so much for coming today. Now, to the exciting portion of today, we get to start to listen to our pitches from our wonderful cohort. So, first up will be Bronwyn Bridges of Pragmaclin. Woo-hoo.
Just going to make sure you can hear me before we start. We have no sound on the video.
We decided to start Pragmaclin because we wanted to be able to help patients see help faster than Gord had to experience and hopefully catch disease progression earlier on. I met Gordon while doing my research, and he came to me with a brilliant idea to be able to help Parkinson's patients. And then our idea actually progressed into a full software which we've developed called PRIMS. It's a Parkinson's Remote Interactive Monitoring System. So in office, a clinician will actually run through an assessment using motor and non-motor data. So the way that the software works is the depth cameras are attached to the computer. The Parkinson's patient just stands in front of the camera, nice and easy, and does the tasks that the computer asks it to. They don't need to attach any sensors. I met Gordon while doing my research, and he came to me with a brilliant idea.
Apologies for the technical delay here.
And then our idea actually progressed into a full software which we've developed called PRIMS. It's a Parkinson's Remote Interactive Monitoring System. So in office, a clinician will actually run through an assessment using motor and non-motor data. So the way that the software works is the depth cameras are attached to the computer. The Parkinson's patient just stands in front of the camera, nice and easy, and does the tasks that the computer asks it to. They don't need to attach any sensors. I met Gordon while doing my research.
Technical difficulties, they happen in life. That is just the way it is today. We have the wonderful Aidan Moores there sorting out everything, and I'm sure it will be up and running in a matter of seconds.
When you're the president. I'm George.
But on another note, how nice is it to be in person? It is so nice to be back and seeing everybody's faces. I mean, I love Zoom, but you know, there's something to be said about getting to meet everybody and getting to interact with everybody. So thank you all for showing up today.
All right, take two. Let's see if this This works for us now.
We decided to start PragmaClim because we wanted to be able to help patients see help faster than Gord had to experience and hopefully catch disease progression earlier on. I met Gordon while doing my research, and he came to me with a brilliant idea to be able to help Parkinson's patients. And then our idea actually progressed into a full software which we've developed called PRIMS. It's a Parkinson's Remote Interactive Monitoring System. So in office, a clinician will actually run through an assessment using motor and non-motor data. So the way that the software works is the depth cameras are attached to the computer. The Parkinson's patient just stands in front of the camera, nice and easy, and does the tasks that the computer asks it to. They don't need to attach any sensors to the body, which makes it really easy for fine motor tasks that Parkinson's patients typically struggle with. At the end of all the tests, the software will actually rate the patient in real-time data and give them a score of where they sit on a Parkinson's scale from 0 to 4. This is able to give clinicians more data so that they can monitor patients over more time and also possibly adjust their medications if needed.
So here at home in Newfoundland, we have only 9 neurologists who are treating 10,000 people with neuro diseases. 1,500 of those patients have Parkinson's disease. Workloads are high, cases are increasing, and clinicians are actually using subjective methods to assess these patients, resulting in 25% of this diagnosis being wrong. From 1990 to 2015, cases have increased to 6.3 million people worldwide, and by 2040, they're expected to reach 12.9 million. Of course, with rising cases means a rising economic burden. And in 2017, the US healthcare system reached a $52 billion burden. We consist of myself, a PhD student, as well as Gord, my co-founder, a Parkinson's patient. We work very closely with a scientific advisor, medical advisor, clinical trial advisor, business advisor, and our software consultant. PRIMS is highly innovative. By using existing hardware in a unique way, we are able to offer a low-cost package system that is great competitors as we cover all motor and non-motor data. We are planning to sell through the business-to-business model to private and public hospitals, private clinics, as well as clinical and research trial organizations. Our initial target market is hospitals in Canada, and then we plan to move to the US, the UK, and Europe. We received 80 customer survey responses, and 98% of the healthcare workers and Parkinson's patients said that they would find this software to be extremely and to somewhat valuable, as well as 90% said they would adopt remote patient monitoring if it was offered to them. So far, we've raised $215,000 to date in private and public funding to develop our MVP, which is currently undergoing a usability testing. We are also able to expand our software and develop add-ons to our technology. We are hoping to be able to cover other diseases in the future, such as Huntington disease, MS, PSP, and even TBI. Therefore, our technology is already highly scalable. We are seeking funding to be able to expand our team, as well as gain certification in international markets and develop more software that we can then prove with other diseases as well. So welcome to PragmaClim, where the future of care starts at home. I believe questions.
Thank you so much. Can you hear me?
I can. I'm just going to move over here so I can hear you better.
Going through the microphone though? I'm not sure if it is.
I don't think so. Aiden, can you turn that microphone on?
Okay, can you hear me better now? Oh.
It's okay. We got our backup.
All right, Bronwyn, thank you. Great presentation. The first question that I have today is about key partnerships. So what are those key partnerships that you see that you would need going forward?
So obviously we're looking for key partnerships in the tech side of things. We've been using CompuSalt as our software engineer currently, but we are hoping to bring on a partnership with a tech body ourselves to be able to have a founding member. So I think that having the tech side of things is definitely key for us moving forward as well. But we're also hoping to have partnerships with the hospitals and universities across Canada. The next phase of our study that we're doing is actually a diagnostic utility study. So we're planning to have clinicians in different hospitals and universities to be able to look at the software videos that we get from patients here. And they're actually going to give a rating. And then we're going to compare the software rating to the clinician rating to prove the accuracy between that the software would be able to assessed properly over time. So I think that having those key relationships with clinicians is going to be crucial to us as well. And we're also planning to have, researchers on board as well who are looking to use this for studies, because that's actually originally how I started to do this. Was I was studying blueberries and Parkinson's disease, and then we realized, well, how are we going to reach the rural communities in Newfoundland, because we know that's obviously a struggle here. And that's kind of how the software came to be, was that, well, we could use the software in the rural communities and access those people who can't get to a clinic as easy or have to wait several years to see somebody. So this is a good stepping ground for that. So I think that creating the partnerships between the universities and us, as well as through the clinicians and us, is going to be key. And we plan to do that in the next 6 months when we do this diagnostic utility study.
Hi, Bronwyn. Awesome job. Love the pitch. My question for you is, what's the cost to switch for a business to actually implement your software, your programs?
So currently, right now, we have it so that you would buy a system outright. So that system would be able to house so many patients on the system. We're hoping that in the future, we can move to a SaaS system where we have, a service as a software there and do that. So we can have a subscription-based model that might be a little bit easier. We're not at that point yet. So currently, you would have to buy the system as a whole, which does include, at the moment, the computers, the depth cameras, and our IP, which is the software as well. So right now, our costing is to be determined. We do have a price right now, but we're trying to modify it a little bit by possibly not using we have a gaming computer right now that we use, and we don't feel that we need that big of a processor. So that's why we're hoping to bring on, and we're seeking a tech person to come in as opposed to using a company that we're contracting out. We're hoping to bring somebody in who can kind of have a look at that and see if we need that big of a processing machine to use it that way.
Hi, great presentation. I just had one question. So who are your competitors right now, and how would you differentiate yourself from them?
Yeah, of course. It comes up very quickly on the slide, so it is a little bit hard to see. So there's kind of two different categories. We have the wearables category, being simple watches and things like that, which really just cover the basic. You're not going to get all the motor tests and everything. You're not going to get the non-motor survey questions as well. We also have the actual sensors. So there's APM and Shimmer. They provide sensors, which are typically used in clinical trials right now. The thing with them is they don't cover the non-motor symptoms, and as well, they're also very costly. So they're about $10,000 for a package of sensors right now, which for a lot of people is not realistic. So in order to sell it, we've done a lower cost option, but we have more symptoms covered than the wearables would be.
Thank you.
Excellent pitch. Loved it.
Thank you.
I do have a question about your target audience. You said you would be going after hospitals and private clinics. Have you tried anyone locally?
Sorry.
Have you tried anyone locally? Have you tried approaching anyone locally?
Yeah, so we actually have a neurologist on board. She started off as like I said, I'm a PhD student, so she started as a committee member, and we've now brought her onto the project instead. We do have a local neurologist on the project, and she does have the connections that we need. Also in Newfoundland, sadly, we have only 9 neurologists, like I said, but because of that, it's a lot easier to reach 9 people than it is several hundred people. And we do have good relationships because, like I said, Gord also is a Parkinson's patient himself. So we've made those connections through him also being seen as well.
And that is time.
Too bad. I was going to ask you another question.
You can ask me later. I'll answer then. Thank you.
Thank you, Bronwyn. Okay, next up, we have Erica Knoll of Optimize You.
Very interesting to be holding this mic, standing in front of you all. I'm excited. All right. What? Oh, yeah, really? Okay. Can you all hear me? Yes? All right. So I'm Erica Knoll. I'm a researcher in kinesiology, and I founded Optimize You and Scientia Access in December of 2021. So as a researcher, I've learned that we can optimize not only how we move, but how we work. And so I decided to found Optimize You as a way to help researchers move their work forward faster.
First, I want you to meet my dog Archer. At the end of every day, typically once it's dark outside, he comes to my gate, looks really sad, and asks me to have some kind of work-life balance. We realized since the pandemic that this is crucial. And as a researcher, it's often hard to get up and hang out with him. However, so what I'm dealing with, and what many researchers are dealing with, is this idea of information overload. So a quick example here is I looked up COVID-19 symptoms since 2022. There's roughly 400 articles published per day. This leads to poor decision-making, reduced productivity, burnout, and the problem's only getting worse with almost 3 million articles being published yearly in science. It costs individuals, organizations greatly. And so what's our solution? Our solution is simple. We want to take a science document and extract the main message, placing a quick summary in front of the reader so they can scan and make a better decision. And who are we targeting? Who are most affected? So we're looking to information seekers in health science. They possess a range of qualities, and it's actually our current millennials who are the most productive, 76% of which have the push of a pet towards maintaining a healthy work-life balance. And they spend almost half their year just completing a literature review before they can even move their work forward. Quick example of what this looks like for our customers is if they read that 100 articles, only 25% of them are actually relevant. That's a huge amount of wasted time and research dollars, energy. And so our market, we're looking to health science. They have a great deal of the publications and 300,000 individuals. We also are looking at our marketplace, and the text summarization space ranges from very simple, where they'll take an entire article and give you one line. This isn't the most relevant for science because it takes out a lot of the context that we need. We hope to bridge this and create a freemium model that will include accurate summaries for scientists. The future of our product looks like a product built by researchers for researchers. We want to create partnerships with university AI programs where we can study the science of science summarization. We also want to collaborate with current researchers who are published so that we can build on their publications. The team includes a strong research focus, but we're looking for someone in tech. We're looking for someone with a background in AI and natural language processing to help us build a team. That's time. Thank you.
Is it on? Yep. Thank you, Erica. Great presentation. I'm someone who's definitely guilty of spending way too much time filtering through articles looking for relevant information. The question I have for you is, at this stage in your development, what do you define as your key pillars for success, or your key performance indicators right now? What's the number one metric that you're looking at?
Good question. Thank you. So for us, our key metric will be the output is what I really need the feedback on from researchers. So if we create a product that doesn't actually achieve what we want, then it's not going to be valuable in this market. We'll essentially be doing what someone else has done. Now, for us, that looks like getting feedback from our researchers and readers on if the output actually did help them more quickly summarize or more quickly make a decision. We could do that through surveys and pretty well surveys and just discussions with our customers going forward. But yeah, it's essentially if it's valid, does it actually help do what we want?
Great, thank you.
Yeah.
Erica, thank you so much for your presentation. I'm just wondering, during the process of going and doing interviews and talking to researchers, what is it that you've learned from them and how receptive are they to this idea?
Thank you. So actually, my original idea with this business pivoted early on when I was talking to customers. I am an exercise scientist, so I had originally targeted that market. But when I started talking to researchers, I realized that this problem is pretty widespread. We all spend way too much time sorting through hundreds of articles just to find a few that are relevant. So, sorry, I'm losing my train of thought. It's very different to be in front of you.
The receptivity.
Receptivity, okay. Yes, very receptive. Most people would like to know when it'll be available and when they can use this because we're all trying to save time. Most people have told me when I polled people on actually how many they read, they also gave me some feedback on how painful that was to only get 10 articles or 6 articles out of 100 that are relevant to them. So the reception is really good, and that product doesn't exist right now, so it would be very influential in the market. Thank you.
Hi, Erica. Thank you. Awesome pitch. My question for you is, as you go into the next step of your business plan, what's going to be your biggest challenge?
So the next step of our business plan is to bring on someone in tech. And with that comes the challenge of actually creating a software that thinks like a scientist. No small, or otherwise I believe it would probably be out there. So doing that training, and that's going to require what in my mind looks like getting articles from researchers, having them give us summaries because researchers know their work best. They can give us summaries for all the sections, and then we can compare that as our gold standard to what our model will create. That's going to be a big challenge and a big undertaking, and why I believe partnering with AI programs would be really relevant. That would be a great research project for someone, and I would love to collaborate and do that. Yeah.
All right. Thank you so much. So you've mentioned that you're looking to target information seekers in health sciences, I believe. Have you thought about any other markets outside of that, one specific segment?
Definitely. So I look first to health science because they're the biggest publishers. And within that, I know to accurately train a model, we're going to have to identify kind of a micro vertical within health science. So that's where we've started. And once we start there, we kind of like to do this sweeping approach across science. My end goal and vision with the business would be to do this for all sciences, but that model would look different for each one. So it would look like the user going in and selecting what kind of scientist they are, and that would tailor their system to give them the most accurate output. So that's kind of why we stuck to health science. And
That is
thank you. Thank you.
Thank you so much. Okay, our next participant to do the presentation is Pillay, and they are joining us virtually today. And to do the presentation will be Saeed. Woo!
Get them back. Hello, everybody. Do you hear me?
Yes, we can hear you.
No, I see my picture is freeze. Just let me.
It is, yes. That's okay.
Something is going wrong because it's loading. Just wait for a couple of seconds. What can I do?
Saeed, you should be able to control the deck there now. If you click on your screen, it might not refresh on your end, but it should work on ours. It's showing us it's good for you.
You know, I think something goes wrong with my system because it is written that Zoom is not responding. It's the overload on the CPU, I think. Share screen, having access to your screen.
Okay. Just give us a second. Does that help any? So you want to go ahead and narrate, and I'll control the slides from here. Just stand by, everybody. We're just having some connection issues.
Saeed is reconnecting now, and he will be back with us momentarily. Again, sometimes tech issues happen, and especially with virtual, but won't be very long, and we'll be back on with the presentation.
I'm back again. I'm back again.
Okay, perfect. Okay, we can see you. Can you hear us? We're good?
Yes, I can. I'm
Perfect.
trying to request for the control request. And, here it is. For test,
Okay.
I move to the next slide. Does it work?
Yes, it works.
Okay. Thanks, God.
Perfect.
Yeah. Shall I start?
You can go ahead.
Aiden, I lost the control to next slide.
Oh, it changed on our end. There you go.
Okay.
It's just a delay. Yep.
Good afternoon. We are Pile. 2 years ago, we started a journey providing pharmaceutical care services for the chronic patients, and we found an important and somehow neglected issue that accounts for more than 30% of the total waste in the healthcare system. Less than half of the chronic patients are adherent to their medications. It's globally an alarming trend, and Canada is not an exception. Pile offers an mHealth solution. It evaluates the chronic patient's health status, and it provides an individualized medication adherence enhancing plan through dynamic daily notification, which is powered by Pile Care algorithms. In parallel, it is able to collect real-world data, which is of particular importance in healthcare system, and it helps us to collect big data. Here is the process. The patient is asked to answer a couple of questions. After collecting different aspects of the health, the analysis would start. 3 different levels of care, from primary to advanced care. Free premium ultimate packages is offered to the patient, and here it is. Patient receives once, twice, or 3 times daily messages. Some of them are just informative, and some of them are collaborative. And it is exactly based on the needs of the patient, and it is a tailor-made solution. And in order to keep the compliance of the patient, there is also an incentivizing system there integrated. Here is our consumer, a 60 to 80-year-old with a chronic disease, taking multiple meds, and he's happy with the features of his smartphone because it helps him feels incredibly powerful. In addition, we believe that the caregiver, healthcare provider, and healthcare system are also the potential customers because they have more willingness to pay, and they have more sense of this pain. We've been able to evaluate, I lost my control to the slides. Yeah, we've been able to conduct many different interviews, and we conducted a kind of pilot trial under supervision of a cardiology specialist with 4 hypertensive patients. After 6 months of monitoring, more than 200 individualized notifications, we turned 4 non-adherent patients to 3.5 adherent patients. There are a lot in the market. They are mainly focused on the medication reminders, but the Pile solution.
1 minute left.
What?
1 minute left.
Okay. A Pile solution is a holistic approach and is tailor-made, and it monitors the patient. Considering the aging population and the increasing trend of using the smartphone, the total market of $400K is assumed. And in terms of revenue, $1 million could be touched after 3 years of being at the market. And we will be at the market by the end of 22. And 24 will be the year that we will have the global version, a multilingual version could be used by all the patients around the globe. We are a team of 3 co-founders, Masood, Farid, and I, respectively, are managing the medical, the IT, and R&D aspects of Pile. We are 22 hours away from you, but we firmly believe when it comes to being present by heart, the distance has no meaning. Pile makes an impact by heart. Thank you very much for your attention.
So much, Saeed. I would now like to invite the judges to ask questions.
Thanks, Saeed. Great presentation. I'm wondering how you plan on launching your brand. How do you plan on launching it?
You know, the launching plan is engaging the physicians. You know, by engaging the physician, asking them to endorse the service to their patients, we can take one by one the patients and starting the plan.
Thank you, Syed. Great job. My question is, who is your target market specifically? Is it pharmacists to push to end consumers, or is it end consumers to push to pharmacists, or would it be an approach to focus on government to implement on your behalf?
You know, the target customer, the consumer is the patient, but we believe that the customer could be the caregiver of the patient and also the physician, because there is a kind of a communication facility for the patient and the physician there. The physician can have a look to the data of the patient, and the government also will have access in terms of using the big data generated in this real world evidence generating system.
Thank you, Syed. I'm just wondering, what are your next plans then? After you said that you just finished a trial, what is your next step after this?
You know, we are as I just shared with the timeline, we need to integrate the system of communication with the physician. We need to integrate an intelligent service in order to plan the future days of the patient, and also the multilingual version is what we are planning, because English is not enough for such service. It is a global issue, and all the patients are suffering from lack of adherence to medications.
Hi, sorry, thank you for your pitch. It's really good. Who is your biggest competitor?
You know, we have, I just shared at the table, we have some competitors. One of them is the competitor who is just a kind of alarming service, but they are very capable of collecting the real world evidence because they have more than 4 million patients integrated to the system, MediSafe. And there are also one service is just focus on the US market. It is Wealth, and incentivizing system is very well defined there. But we believe that the customized, tailor-made service of Pile is the competitive advantage.
Hi, great presentation. So as you mentioned, Newfoundland and Labrador especially, we have an aging population. How do you intend on marketing your product to those who may not be?
Unfortunately, that is time for the questions. Sorry to cut you off. Thank you, Saeed. We would now like to invite everybody to have some refreshments, enjoy the lovely spread of food we have, and some beverages. And we are going to reconvene at 4:15. Enjoy. Thank you. That we can move on with our next pitch. Okay. Give everyone a moment there. I would like to introduce our next group of founders to the podium. And we have Julia Daniels and Christy Mick, and they are from Book Up.
We are. We're here. Okay. Is that the clicker? Are you guys like gonna get like one of these when it's time to go? Or
We'll give you a 1 minute mark at the end.
Hi, I'm Julia. This is Christy, and we're Book Up.
I've been running vacation homes in Bonta Vista for 7 years. We do this remotely while working and while raising our 2 beautiful daughters. We've had several issues that we haven't been able to find local support to solve. So we also had a lot of issues with time management. We tried a few different property management softwares, but they were expensive and user-friendly. So we thought, wouldn't it be awesome if we had a reliable solution to these problems?
That's why we created Book Up. We provide small-scale, short-term businesses that do short-term rentals with innovative, cost-effective tools to streamline their processes and save time and money. Our minimum viable product is user-friendly property management coupled with direct booking templates that work in unison with all the industry giants such as Airbnb to ensure you have time for the personalized approach. There are companies in the market that provide these services to larger accommodators, but what was missing is something with the small guys in mind. So that's what we're here for. That's what sets us apart from our competition. Our holistic approach to property management. We offer a wider range of services than other people on the market. And really what it is people is what makes tourism great. So giving the right people the right tools will ensure an amazing experience for their travelers and not just a place to sleep.
Our total Canadian addressable market of 75,000 listings is growing annually. Our sales addressable market consists of short-term rentals with 1 to 3 listings, and this is whom our MVP is tailored to. And our target market and first-year goal is to reach 350 listings. Our products are going to be available as a software subscription, and this is established through direct and indirect sales efforts. And as we grow and create more products, we'll be generating more revenue streams.
Genesis taught us to unbundle the size of our offering to establish our easy-to-use software package. With over 100 customer interviews, months of market research and pivots, we understand the problem and we have the solution. Our websites are about to launch. Our direct booking templates are being coded. Pre-sales have started, and with the aid of a digital advisor, we're going to help our clients avail the Canadian Digital Adoption Program to digitize their services through Book Up.
Our future begins with you. We are looking for partners and collaborators within the industry that want to help support the small accommodator. We're going to be creating franchisable business models that we're going to first roll out across Newfoundland and then eventually across Canada. I'm Christy Mick, and myself and my husband are the founders of Book Up.
I'm Julie Daniels, the sales director. Book Up will become the hub for all things tourism in Canada, but we need your help. Please let your friends and family who are in the short-term rental business, tell them about our social media pages, come visit us, because our growth depends on our neighbors and friends recognizing the value we wish to bring into their business. I don't know if we're done or not. Thank you all. I just want to run.
Hi. Hi, good job. Good job.
Thanks.
Got it right under the wire there. Impressive. So why did you choose the franchise business model?
We've thought about it so many different times of how to grow, and because we are offering so many different services as we are going to grow, because from our clients that we're going to be establishing through our MVP, we're going to be adding employment services and pay-per-use property management services. So try to organize that across the country and in different tourism regions is going to be way too hard. So what we're hoping to do is we're going to find like-minded individuals like ourselves within the industry that want to create a franchisable tourism industry, right? Like a platform in their little community. And so that's why we want to make it franchise. So then it also offers everyone in the smaller communities and for these people to get more involved and make the change and just get the supports that we actually need.
Like where we are in Bonavista, so what we were trying to do is help local people get some jobs or bring back some young people back to our communities. I was away for so long and coming back to an actual job. We want to build that in little communities across Newfoundland first and then hopefully across Canada.
Ladies, great job. You talked about this platform, this software being all things tourism. So I'm just wondering if this software is scalable so that you could offer other tourism products.
Yes, that's a good question. Yes, 100%. Like I said, with our beta testing too, we're using a third party to just get our research and development started to then build our actual product with our consultant that we have. And I just lost track of my thoughts on that.
Okay, we actually, we had a huge idea that Genesis taught us to unbundle. So there's going to be advertising, experiences, Connect a Pro. So people who run short-term rentals know how hard it is to find cleaners that are reliable, say, especially in rural areas. So what we want to do is build all of these things into our platform so it will grow more revenue streams, scalable, bigger. But our minimum viable product is just the property management software, and then hopefully we'll raise the funds to grow the rest. But we are building a giant website that includes all of those other things.
And sorry, just one more thing with that. For the travelers, the benefit for the traveler is going to be too that once we get this fully established, it's going to be one-stop shop. You're going to be able to book your entire Newfoundland trip or your entire, Lake Huron trip or wherever you're going to be. So you're going to be able to click the accommodations you want. You're going to be able to click the experiences you want. You're going to be able to get discounts that are going to be offered by different businesses and gift certificates and whatnot, and do one payment. And with an extremely low service fee for the traveler and no service fee for our hosts because they're going to be with us in already partnership. So it's going to be a cheaper and a more time-effective way to travel.
Thanks. Love the name, by the way. It reminds me of Hookup.
Oh, thank you.
Love the energy. I guess just getting back to the franchise model and how your revenue breakdown is worked. So you said it's a low cost for user, but I'm assuming that, you as the corporate entity will have to get a fee. If it's one payment, does it go to you or does it go to the franchisees and then there's a fee? Like, have you given any thought to what that revenue generation model looks like?
Yes, for the franchise, of course, there's going to be like a franchise cost because there's going to be cost to, rebuild onto the website for their own tourism reasons. So it would be like a book up, Bonavista or whatever it will be. So there will be a cost to get that built. And then there's a cost obviously for training and services. And for ourselves, there's going to be a revenue stream of obviously a franchise cost and marketing costs as well. Did that answer the question?
Yep, great, thank you.
If not, we'll meet you later and tell you everything you want to know.
Okay. All right, I love it.
That is time.
Thank you guys so much. Thank you all. Thank you.
Thank you, Christy and Julia.
Oh, thank you. Oh.
I would now like to invite to the podium Karan Singh of Med AI.
Good afternoon, everyone. Good afternoon, everyone. We are MedAI, an AI startup for early disease detection. Do you know that cancer causes 1.6 million deaths every year? And about half of these deaths are caused by lung cancer in stage 4. And if you are unlucky and you are diagnosed with lung cancer in stage 4 or stage 5, the chances of survival are less than 10%. And the reason the radiologists are not able to predict the lung cancer in first 1 to 3 stages is that the lung nodule size, so nodule is the cancerous patch, is so small that radiologists also misses out to pick it up. So to solve this problem, we have developed an AI-based solution, which you can see working. This is one. So here's a working prototype. A patient goes for a lung cancer screening. He has lung cancer in stage 1 in 2019, and our AI is able to predict it. But the radiologist is not able to predict because the lung cancer size is so small. And after 2 years, that lung cancer has turned into stage 4, and our AI is again able to predict it, and now the radiologist also is able to predict it. but our AI was predicting it back from stage 1. So our AI can help and can work as an extra pair of hands and eyes for the radiologist to predict the lung cancer in the first stage. Next slide. Next slide.
Hold your mic up.
So our target customers are radiologists, hospitals, and OEMs. And our market size for the entire world is 10 billion, and for Canada is 50 million, and for Newfoundland, which is not visible, it's 1 million, and we are going to charge $10 per diagnosis. And our competitors are based in Israel and USA, and there is no competitor in Canada, and our approach to capture the data set is different. And all the competitors are working on bone or health brain solution. We are going to work on lung cancer as well as other body parts. And our AI works with the radiologist, and it keeps improving with the radiologist, which is unique and no one has that. We are already done with the phase 1. We have the beta models ready. Now we are going to test our models with the local hospitals, and the next stage is to scale globally to the other province. And by this year end, we will be releasing a SaaS-based platform where a radiologist can upload the scan and get the diagnosis result. So our key impact is we are improving the accuracy because our AI is trained by multiple radiologists, and it's also reducing the time because our AI is not predicting the diagnosis in 5 minutes as compared to regular radiologists, which take 15 minutes. And we are reducing the cost and wait times. We have the great team with Dr. Matthew, Dr. Edward, and Dr. Pierre. Everyone has around 30 or 40 years of experience in radiology and computer vision. I myself have worked with 3 different startups, and this is my 4th startup. I'm also doing my research on lung cancer screening. So our long-term goal is to equip every doctor with an AI, and it's an opportunity, it's not a threat. Thank you.
Thank you so much. My first question today has to do with your customer interviews. So when you were out doing interviews with radiologists, what is the main thing that you heard from them?
So the main problem they have is the wait time, and because there are a lot of cases, and also due to COVID, everything is piled up, and they are not getting time. And in Canada, there's like 1,000 radiologists for 100K people, so that number is huge.
Awesome pitch. Is your software compatible with the existing systems that the radiologists use, or is there a cost to switch?
So the existing system is called PACS. So we are going to integrate directly with the PACS system. They use RJ45 cable. So we can, right now, we don't have the ethics approval for that, but we know how to do it.
Apologize if you said this. So at what stage do these patients come? Have they already been diagnosed at the stage at which they would use your product?
No.
Okay.
This is for the early diagnosis, early screen. So stage 1, 2, 3.
Okay.
Thanks, great pitch. So you talked about lung cancer. What other cancers and diseases would you be?
So we'll be dealing with brain tumor as well, and prostate and other type of cancers. So everything related to cancer.
So why did you come up with this idea, and like why are you so passionate about it?
So we want to develop something and save nation, save people. So that's our motive. Because right now, if you see, I have an ECG on my watch, and I know how's my heart conditions. But for the cancer, there's nothing like that in the market. So if you see 20 years or 30 years down the line, we'll need AI systems for cancer detection as well.
Thank you.
Thank you. Great concept. It's great to see so much effort in AI and healthcare systems. As you went through your process, is there any key learnings that you look back on and you would have decided to do something different?
Yeah, so we did many iterations. Earlier, we were just focusing, on X-rays, but then we went from X-ray to CT scans because X-ray is not that big problem. There's not much false positives in that, but in the CT scans, there are less. There's more false positive as well, and also if there's a cancer, sometimes that also is there's missed cases as well. So that's why we keep on changing our product. So we might add more things by next year as well.
Great. Thank you very much. Good presentation.
Thank you.
Thank you so much, Karan. Okay, now I would like to introduce to the podium Tiona and Mary Cochran and Benham Fardy of Working IT.
Are we ready? Okay. Good afternoon. We are working at Immigration Solutions. My name is Tiona Corcoran. I'm an immigration consultant with 15 years experience in corporate global relocation, 75 markets, and I've lived in 6 countries. I'm frustrated with the archaic paperwork that plagues our industry. This is Mary Corcoran. She is an educator with 35 years experience and has hosted international delegates and study abroad tours. This is Benham Fardy. He is a software developer, international student, completing his master's at MUN. Can't hear you. Can you hear me? There we go. And this is Benham. He's completing his master's at MUN. Together, we are building the technology to move immigration from the paper and faxes into the digital era. The decision to move yourself or your business across the world is overwhelming. The process is complex and people don't know where to begin. There are tax, employment, and immigration requirements that must be adhered to. We have developed technology to automate the process, reduce duplication of data entry, create the right entry points for professional interaction and guidance. Our product can be used by legal firms, employers, and individuals. It is replicable for other countries, creating a better user experience and making our services scalable. Here's what the application currently looks like, and here's what we've developed. Since we began the Genesis program, we have received over 100 inbound leads per month from clients in over 20 countries. We ran sprint testing to validate our content for our landing pages and received feedback from over 50 users. We had 120 client discovery calls and developed a partnership with Integral Business Insights for Startup Visa. Our model is replicable with interest from companies in San Martin, Swaziland, Malta, El Salvador, Costa Rica, and Luxembourg. We have expanded our team to add software development, integration, AI, digital marketing, and international finance expertise. We have 2 students joining for summer interns. Market size and competition. The immigration and legal tech spaces are underdeveloped, with limited number of players who are collaborators, not competitors. We are all working together to move immigration to the digital era. The future is bright. 35 million tech workers are moving globally, with over 300,000 coming to Canada each year with a 10% annual growth. Last year, our firm was only able to average 1 file per month, resulting in a revenue of $72,000 for our first business operating year. Our technology will increase the volume to a minimum of 10 files per month for the next business year to increase revenue to $7.2 million. We do not have a demand side problem. We have the clients, they are ready, waiting, and hungry for our solution. Our ask today, we need help building this solution. We need experienced startup leaders to provide us with business and product development mentorship. We also welcome in-kind contributions of time, software licenses, and devices. We have the opportunity to be the leaders as the first and only immigration tech firm specializing in global relocation, and we need your help to do it.
Thank you so much for your presentation. My question for you today is, are you focusing first on the Newfoundland and Canadian market and then planning to expand for there? Or how do you see yourself going forward in the future with scaling up?
That's a really great question. So we are building iteratively. We're testing out different pools. So we have 3 determined pools, and we're dividing it down and building each user journey and testing it with our clients as we move forward. So in the recent hackathon in Mount Pearl that we attended, we built a tool specifically for employer designation for the Newfoundland immigration program, specifically for the Atlantic Immigration Pilot Program.
Awesome pitch. So my question to you is, how would the pricing work? Does the business or the government agency pay, and then does the user pay?
Okay, so in terms of it, it's typically a business entity because we do corporate global relocation. So the end user would be the individual, whereas the company is typically paying for the legal fees.
So I guess twofold. So did you mention before that you were looking to market to law firms? Is that
They are one of our clients.
one of the clients?
One of the
Okay.
clients, yeah.
All right. So I guess what would be your pitch specifically to a law firm? Like what can your product provide that isn't already out there?
There aren't any solutions out there right now. We are doing paper and faxes.
Hello, great pitch. So have you, and very timely idea as well. I think that we need all the help that we can get to bring people into this province. Have you had any luck with the local government, so the Department of Immigration?
We did reach out to them and just received an email back saying sort of this is what the process is. But in terms of a partnership or any leverage at this point in time, nothing.
I had a similar question and more, I guess, on immigration is very regimented and regulated. And it's also provincially regulated to a degree as well. There's federal, but each province has some. So, in your model and your plan, how are you addressing those variances and the challenges of regulation within government to sort through that?
So that's where my subject matter expertise comes in. So I am a regular Canadian immigration practitioner, so I am legally allowed to practice. I have to be up to date on all of those rules, procedures, operation manuals. That's what I fall asleep at.
That'll help. Great job. Thank you.
We're good.
Thank you very much. Okay, so now while our judges are going to deliberate and determine the winner of this event, we have the exciting opportunity to all amongst ourselves individually vote for the Community Choice Award. So you had a huge variety of companies just then, and it was an amazing selection, and I think everybody did just a stunning job. So now, our Community Choice Award, you get to go to slido.com on your phones and use the code 310932.
We vote for ourselves?
Thanks, Julia. So you can vote for one of our 6 participants. We have Pragmaclin, which was Bronwyn. We have Optimized You, which was Erica. We have Pillay, which was Saeed. We have BookUp, which was Christy and Julia. We have MedAI, which was Karan. And we have Working IT, which was Tiona, Mary, and Benham. So first, I would like to invite Victoria Blagden of Blue Drop Learning Networks to present the first award.
Just a fashion accessory anymore. Blue Drop ISM is proud to support the Genesis Evolution Program with the Blue Drop Innovation Scholarship, providing these entrepreneurs financial help to navigate the rough waters of the tech startup world. With the guidance of this program's advisors is the best way that we could think of to contribute. Blue Drop's own startup story came with no instructional manual. To listen to Imad tell it, it plays out more as a comedy set with an occasional setback, suspenseful twist, and then a retrospective self-discovery of us asking the question, how the hell did we do it? Our chosen recipient for this year has had ups and downs, but they are headed in the most promising direction. recognizing the challenges of our busy lives and developing tech that enables users to have access to supportive tools to make their lives easier and healthier. I am pleased to award and to welcome to the front of the room the recipient for this year's Blue Drop Innovation Scholarship, Elaine Cunningham from Pichet.
Thank you so much for this. This is awesome. I really appreciate it. So my name is Aileen Cunningham. I'm from Antigonish, Nova Scotia. I'm a Munn student, so I've been there. I'm in my second year of my degree, and I'm doing civil engineering. My company's Pinche. I have a business partner, Sebastian, and we've been working on it through this term. And I'm just excited to see where it goes from here. I'm also really excited to get this award because my grandmother was also a woman in entrepreneurship, and she had, a restaurant in downtown Toronto with her sister for a number of years. So it just means a lot to get this award. So thank you.
Congratulations. I would now like to invite Anna Gray Campbell, Manager of Community Engagement, Genesis, to the podium to announce our Community Choice winner.
Fabulous job, everyone. Our Community Choice winner tonight is Pragma Research. Come on up. Bronwyn and Gord. Come on up. Having a great month.
Oh.
I was gonna say, for those who haven't seen Gord in person, this is Gord that I talk about in the video. Where'd Gord go? Thank you so much for the voting and choosing us. We appreciate it. The last couple of weeks have been a whirlwind. We've gotten a lot of opportunities and a lot of great connections have been made, and we're really excited to see where this goes.
Great, Bronwyn. Thanks very much. And we appreciate all the help that we're getting from the community and everyone else that's helping us along the way. And we're going to go very far together with this, for sure.
You are.
Thank you.
Congratulations. Okay. I'd now like to invite Lara, our success manager of belonging for Genesis, to the stage to announce our runner-up and our first place winner.
Awesome. Well, thank you. And the second place is going to be for Working IT. Congrats, guys. We'll take the bigger one. Congrats, great job. Go stand up for pictures. Oh,
Say a few words. Thank you guys so much. It's been a pleasure being in the Genesis program. We really learned a lot and received so much community support and support from all the cohort members. It's been so much fun, and I recommend it to any entrepreneurs starting up. It really helps you define your product.
Come on, Mary.
I was retired, but now I'm back into it again.
So excited. Thank you, everyone. Thank you, Genesis, for your help. Thank you.
Welcome back. Okay, Ooh, very exciting. Okay, so the first place winner, first place.
Hang on, the mic is dead.
Oh,
I was wondering. Oh, I know.
Oh, okay. We're good. Can you hear me there? Yeah. Okay, so first place is for Pragma Clean. Woo! Congrats.
Shall we say the same words again? Thank you. I was going to say.
Back again.
Yeah.
Back again.
Thank you. Thank you again. Seriously, it means so much. And like I said, only events like this only propel us farther forward. So it's fantastic. And even just being here today, I've made so many more connections with people, and it's been already super helpful. I'm like, my LinkedIn is going to be on fire. Thank you.
Thank you very much.
I'd like to say a huge congratulations to our winners and to all the participants today. You all did amazing. You have come so far. You have made such huge strides, and it was wonderful to watch you grow throughout the evolution cohort. Great job, everybody. Give yourself a big pat on the back. And Genesis is looking forward to working with you all in the future as you continue on your entrepreneurial journeys. I would like to thank the Honorable Andrew Parsons, Minister of Industry, Energy and Technology, Brendan Brothers, Verifin, and our sponsors, Springboard, TD, Hickman Automotive Group, Ray Agency, BDO, Cox and Palmer, our judges, Kevin Peters, Nyla Kiley, Sarah Nolan, Kara Strickland, and Jenny Smith. Woo! All media representatives, the Hunger Earth Cafe and Toslo for the amazing food and drink, and everyone else who has contributed to the planning and execution of this event. Great job, everybody. Thank you so much.